The e-cigarette was first developed by a pharmacist in China in the early 2000s. It is a device that produces a nicotine aerosol by using a battery to heat a solution. The device has a mouthpiece for inhaling the vapor. There are many pros and cons to the e-cigarette. So starting with the pros, the main reason why the e-cigarette first came about and was invented was to stop smokers from smoking cigarettes. So it's an alternative approach to quit smoking. It's definitely less lethal than regular cigarettes because it doesn't contain tobacco. A study showed that people who switched from cigarettes to e-cigarettes had less carcinogens in their body than those who continued to smoke. Cigarette smoke contains a suspension of gummy residue known as tar, and most of the carcinogens in cigarette smoke is from the tar. These e-cigarettes do not produce that. It delivers the vaporized nicotine to the lungs without the toxic byproduct that accompany the smoking of tobacco, so leaving the smoker feel a lot more natural. It is easy and convenient, which could be a good thing, but that can also be a bad thing. So they can be smoked in more public places. It's a little bit more widely acceptable, socially acceptable, because it doesn't have that foul smell. There are actually a lot of pleasant smells. But this also, unfortunately, makes it easy for kids to hide from authority figures. The e-cigarettes taste good, which is a pro to cigarette smokers, but this is a negative for teens and young adults because this targets them. So these fruity cotton candy and Skittle flavors are definitely attractive to the youth, causing them to use them. Switching to the e-cigarette has reduced the craving to smoke for many. Also for smokers, exposure to nicotine when smoking the e-cigarette has been shown to decrease. And finally, studies suggest that e-cigarettes may be as effective or better than other replacement products in promoting smoking cessation. So now moving on to the cons. So these e-cigarettes contain nicotine, so they are definitely addictive. And the reason why it's so bad that they are addictive is because as of 2014, they have not been researched, regulated, or controlled. They're largely unregulated, and there's a lack of quality control over the different components in the e-cigarette. So for example, the additives such as flavor enhancers and the concentration of the active ingredient itself. So in other words, this liquid substance could contain pretty much anything, so we don't really know what we're smoking. Since we don't know what's in these e-cigarettes, we can't be sure that they are safe. Years ago, people thought cigarettes were safe. In fact, it was even said that they had health benefits, but look how that has turned out. E-cigarettes are also associated with respiratory systems such as wheezing and coughing, increased airway hypersensitivity, increased airway resistance, and decreased host immunity. Also, exposure to diacetyl, which is a common e-cigarette flavoring, has been associated with acute onset bronchiolitis, or something known as popcorn lung, which is a severe and irreversible obstructive pulmonary condition. Also, these e-cigarettes may explode. It's definitely rare, but it has occurred before, and it is caused when the battery is overheated. These occasions have led to chemical burns, teeth loss, and soft tissue damage. They also represent a gateway to smoking cigarettes for young people. So this has led to teens and young adults smoking nicotine, those who wouldn't have otherwise tried it if it wasn't for the e-cigarette. This increase in nicotine addiction has a greater chance in leading them to smoke cigarettes rather than swaying them. In 2016, over 2 million middle school and high school students had said they tried the e-cigarette before. People who are ages 18 to 24, 40% of those who use vapes weren't smokers before, and I can only imagine that number has gotten higher or at least not changed. Also, inhaled nicotine increases heart rate and blood pressure. And finally, nicotine is highly addictive and may lead to changes in the brain that increases the risk of addiction to other drugs.